here to talk to us about the coronavirus vaccine of any of the forms of any three. So thank you for coming on the show, and I hope you're having a great day so far.
Thanks so much for having me.
Of course. So obviously, and it seems like in the last 6 weeks, the vaccination process is almost continuously, it's exponentially grown about how many people can get the vaccine, how many vaccines are available to the public. So just with all of the growth that we've seen, how is Blue Cross Blue Shield helping get shots in arms?
Yeah, absolutely. So the message that we want to get out is as soon as the vaccine is available for your group. So right now that as of today, in fact, Monday, those are people who are over 55, people who are over the age of 16 who have a chronic condition. Those are people who have intellectual and developmental disabilities, in addition to the earlier groups that we've already had vaccines for, right, which were frontline healthcare workers, residents, and staff at long-term care facilities or nursing homes, and some groups of essential workers. So we've really expanded the list of availability as of today. So we really want to encourage everybody. You can go to the ADPH website. You can check and see when, if you're in the list of people who are eligible to receive the vaccine. And then we really encourage everybody who is eligible to reach out. You can reach out to your provider, you can reach out to your pharmacy, or you can reach out to ADPH either through their website or by telephone.
Awesome. And I think as we've seen more and more people get vaccines, we're also kind of seeing, I guess you could say, vaccine hesitancy, where people are kind of scared to get the vaccine. Maybe they would say is a lack of data. What was something you would say to kind of convince someone that this is a safe vaccine and you shouldn't worry to go get your shot?
Yeah, absolutely. So that's a great question. We understand there is some hesitancy out there. We just really want to encourage everybody, you know, as a physician, really encourage people to get the vaccine. There's been so much testing. There's been so much tracking. There's been so much evidence that these vaccines, they're safe, they're effective. They're up to 95% effective in preventing COVID-19. And so it also encourage people, talk to your provider, talk to your physician, talk to your pharmacist about it, and also reach out to people that you know who may have gotten the vaccine. Talk to them about it, see how it went. We're hearing a lot about really smooth appointments. People can make an appointment online or by phone. They're going there, they're getting their vaccine, they're waiting their 15 minutes, then they're going home. And so it's really been a smooth process. And again, I can't emphasize enough, these vaccines are safe, they're effective, and they've been tested. So really want to encourage people to go and get those shots.
All right, sweet. And then obviously when you get those vaccines, whether it be the Johnson & Johnson, the one shot, or the Pfizer, the Moderna, you get both shots. How much of a normal kind of normalcy of a life can you go back to after you get your fully vaccinated shots?
Yeah, so the recommendation right now from the CDC is after you're considered fully vaccinated. Let's just back up a second. You're considered fully vaccinated about 2 weeks after your final vaccine. So as you said, for the Johnson & Johnson vaccine, that's about 2 weeks after your first shot, your only shot. For Pfizer and Moderna, that's about 2 weeks after your second shot. And so the recommendation is still to wear masks, still to practice social distancing, still to wash your hands frequently when you're in public and when you're around other folks who might not be vaccinated. But there are some new recommendations that say when you're in groups of people, small groups of people, especially those within your household, and everyone's been vaccinated, you can really loosen a little bit of those recommendations. So you can have some indoor gatherings without masks. You can, you know, have a little bit closer social distance with people who are fully vaccinated. So I think that's a great, you know, another great reason to go ahead and get the vaccine as soon as you can, because the sooner you're fully vaccinated, the sooner you're protected, and the sooner you're helping protect the rest of the community as well.
Awesome, and that's something I'm sure all of us want, is just go back to normal pre-2020 in March. So again, Dr. Schmidt, thank you for coming on. Unfortunately, that's all the time we have for today.